Hello, this is Dr. Mary Manis. Today we'll be talking about professionalism in osteopathic medicine, ethical foundations. Presentation objectives are to identify sources of ethical foundations in Sam Houston State University College of Osteopathic Medicine professionalism curriculum, and identify 6 ethical foundations of professionalism in osteopathic medicine. So, sources for ethics and professionalism. Who determines ethics for your profession? Well, as we've discussed, the American Osteopathic Association has an osteopathic code of ethics that can serve as a guide. Depending on where you practice, there will be other codes of ethics that will be mentioned and required. The American Medical Association has a code of ethics, and the American Board of Internal Medicine Foundation, the American College of Physicians Foundation, together with the European Federation of Internal Medicine, published Medical Professionalism in the New Millennium, a physician charter in 2002 that is being more and more widely used. So, what are the AOA's rules and guidelines on physicians' professional conduct? As we've discussed, responsibility to patients and accountability to self, peers, and society are what make up the rules and guidelines. Primacy of patient need, respect for people and cultures, awareness and action regarding health disparities, regulation of self and peers, lawfulness, and legitimacy. This reminds us of what requirements exist for a profession: to acquire pertinent knowledge and skills, to apply knowledge and skills within a code of ethics, to maintain a contract with society, to bond with peers by shared commitment, and to regulate self and peers. Who determines ethics for your medical education? Well, here at the COM, leadership and administration have written programmatic level learning objectives for professionalism. Commit to ethical principles and demonstrate behaviors of respect, compassion, probity, honesty, and trustworthiness is the one that most likens to ethics. Other determinations are stated in the COM Student Handbook, including the Honor Code, and the SHSU Code of Student Conduct and Discipline. So what are the ethical foundations, the ethical principles of professionalism? There are many ethical principles, and they have considerable overlap. So who should determine which ethical principles apply to medicine? Who should determine how ethical principles are applied to medical practice? Can components of professionalism and principles of ethics in the practice of medicine be associated? Can professionalism be viewed as applied medical ethics? Let's review the principles of ethics that apply to the practice of medicine the best, and maybe we can answer those questions. So the first principle is autonomy, or freedom from external control or influence, independence. An example of this in professionalism is that physicians are required to respect the right of competent adults to make informed decisions about their own medical care. This is the concept of informed consent. Second principle is non-maleficence. Its definition is actually what it isn't. It's the opposite of the noun form of maleficent, which means causing harm or destruction. An example in professionalism is that physicians are required to act to protect patients from risks to patient safety or from a physician's lack of fitness to practice medicine. So the concept is patient safety. Third ethical principle is fidelity. Its definition is faithfulness to a person, cause, or belief, demonstrated by continuing loyalty and support. An example in professionalism is that physicians are required to be trustworthy, honest, and open in their interactions with patients and about patient care. This concept is communication. Fourth ethical principle is justice. Its definition: the quality of being fair and reasonable. Social justice is one of the ways justice can be represented as an ethical principle. It's in terms of the distribution of wealth, opportunities, and privileges within a society. An example in professionalism is that physicians are required to promote fair treatment in healthcare so that disparities are eliminated. And this concept is social determinants of health. A fifth ethical principle is beneficence. It is a noun of the adjective beneficent, or resulting in good. An example from professionalism is that physicians are required to relieve needless helplessness and suffering from physical, mental, and spiritual pain. The concept there is empathy. The sixth ethical principle is utility. Its definition is the state of being useful or beneficial. An example in professionalism is that physicians are required to strive for value in healthcare to bring about the greatest benefit with the least costs. Concept here is health systems. So the 6 principles: autonomy, non-maleficence, fidelity, justice, beneficence, and utility. Medical ethics can be the foundation for professionalism in osteopathic medicine. Professionalism encompasses the ethical framework in which osteopathic medical knowledge and skills are acquired and applied. We will be expanding on this topic in our next lecture, Professionalism, Ethics in Action. Thank you.